Okay, so I want you to picture something for a second.
Hmm.
Look closely at an elegant, like super glamorous Afghan hound standing completely still on a grooming table.
Oh, yeah. You know the exact image.
Right. The lighting is perfect, the coat is meticulously spread out, and there's a brush just moving rhythmically, section by section through that famous flowing hair.
It looks so pristine.
Exactly. And to the untrained eye, this entire scene just screams pure vanity. Like it looks purely cosmetic. Just an obsessive dedication to keeping a show dog looking exactly the way a show dog is supposed to look.
Yeah, and that visual practically defines luxury pet care for a lot of people. I mean, the assumption is that this is essentially a spa day for dogs, right? Just focus entirely on aesthetics.
Totally.
But that assumption totally misses the reality of what is actually happening on that table.
Because the real mission here, and this is the core of what we are unpacking from this stack of veterinary notes, grooming records, and expert breed guidelines today for this deep dive, is what happens underneath all that hair.
Right. It's not just styling.
Not at all. As those hands move through the coat, they are conducting a covert, rigorous, and highly systematic physical exam. I mean, they are mapping out the ribs, feeling if the tissue coverage over the spine has changed, but even a millimeter since last month.
Or detecting, like, a localized patch of inflamed skin hidden deep behind an elbow.
Yeah, and I'm just so fascinated by this because it completely redefines what preventive care means.
The stakes of that tactile mapping are incredibly high. Because, we often think of preventive healthcare as an event, like a once-a-year appointment where a vet gives vaccines, runs a quick physical, and sends you on your way.
But for this breed, it's totally different.
Oh, completely. For an Afghan hound, preventive care is a daily physical rhythm because that coat is basically a biological master of disguise.
I keep picturing someone wearing a massively thick, oversized winter parka, like zipped all the way up to their chin.
That is a great analogy.
Right. If you are just looking at that person from across the room, you have absolutely no idea what their actual physical condition is. I mean, you couldn't tell if they're an Olympic decathlete at the peak of cardiovascular fitness or someone who is profoundly out of shape.
Exactly, because the visual data is just completely blocked by the fabric.
Yeah. And the danger of that biological parka is that it doesn't just hide a few extra pounds.
No, it obscures massive systemic regressions. I mean, you can have severe muscle depletion happening over the shoulders or the hindquarters, maybe due to age or some subtle underlying injury, and you'll never see it.
Wow. Just completely hidden.
Totally. You can have a creeping skin infection spreading across the back. If you are only ever visually assessing your dog, you are operating completely in the dark.
Which means the owner has to, consciously override their own visual instincts.
They do. It takes a lot of focus.
Because when you have a dog on that table, your brain just wants to focus on detangling the hair.
Right.
But you have to force a mental shift from, I am brushing to I am actively diagnosing.
And that requires deliberate intentionality. While the brush is doing the mechanical work of separating the hair, the free hand actually has to become a scanner.
A scanner. I love that.
Yeah, you are tracing the skeletal structure. You need to memorize the exact geography of your dog's ribs, their spine, their hip bones when they are in perfect health.
So that your fingers just instantly recognize when that baseline shifts.
Exactly. And it goes beyond bone structure to the skin microbiome itself.
Right, because the sources highlight skin irritation as a major hidden threat here. Particularly in high friction zones, right? Like behind the ears and the armpits, around the tail.
Yes. It's not just about brushing out mats. It's about the environment created by that heavy coat, especially when water gets involved.
Oh, the moisture warning in these notes is wild.
Moisture is the catalyst for disaster under a coat like that. When an Afghan hound gets a bath or, even just gets soaked in a rainstorm, getting that coat 100% dry down to the skin is mandatory.
100%.
Yes, completely dry. Because if dampness remains trapped beneath that dense outer layer of hair, the dog's own body heat turns that moisture into a literal greenhouse.
Oh, wow. A greenhouse.
Yeah, it creates this dark, warm, humid microclimate. And that is the absolute perfect breeding ground for yeast and anaerobic bacteria.
That sounds awful.
It is. What starts as a little trapped water silently ferments into a massive, agonizing skin infection.
So, hearing the sheer amount of daily labor and risk involved with this coat, the immediate logical question that I think anyone would ask is, why not just shave it off?
Oh, I hear that all the time.
Right. Just take some clippers, cut the parka down to a buzz cut, and eliminate the greenhouse effect entirely. Instant access to the skin, zero detangling required. Easy fix.
It sounds like the ultimate life hack, doesn't it? But the biology of a double-coated dog violently rejects that shortcut.
Wait, really?
Yeah, the coat isn't just an ornamental accessory. It is a highly evolved thermoregulatory system.
Okay, so it controls their temperature.
Exactly. It insulates them against freezing temperatures, but it also traps a layer of cool air against the skin in the summer to prevent overheating.
Oh, I didn't realize it works for the heat too.
It does. And furthermore, it acts as physical armor against environmental hazards like thorns, and it provides crucial protection against direct UV radiation and sunburn.
So shaving them actually destroys their natural defense mechanisms.
Completely. I mean, unless there is a dire medical necessity like severe impenetrable matting that is actually pulling on the skin, or a surgical procedure that requires a sterile field shaving, should never be used as a lazy way to bypass the work of daily observation.
That makes total sense. So once you've mapped the main torso, felt the spine, and ensured the skin is dry, the hands just naturally gravitate toward the localized areas, right?
Yeah.
Extremities.
Moving outwards from the core.
And this seems to be where minor issues quietly escalate into permanent damage if they aren't caught early.
The ears and the eyes are prime examples of those high-risk localized zones.
Let's talk about the ears first, because we just discussed the greenhouse effect with the coat.
Right, and the ear canals function on the exact same principle. The heavy, beautiful ear furnishings on an Afghan hound act like thick curtains. They completely block natural airflow into the ear canal.
Which means more trapped moisture.
Exactly. That trapped, stagnant air invites constant yeast and bacterial growth.
But the notes are very specific about the intervention here. Like, they explicitly warn against frequent aggressive ear cleaning.
Yes, because the delicate tissue inside the ear canal can be easily microabraded by harsh scrubbing or strong chemicals.
Oh, so you're actually causing microscopic scratches.
Yes, and those tiny scratches then become entry points for the exact bacteria you were trying to clean out in the first place. The intervention has to be incredibly gentle, just focus on wiping away surface debris rather than excavating the ear canal.
Okay, that is a huge distinction. And then we have the eyes, which for an Afghan hound are their defining evolutionary trait. I mean, this is a sight hound.
A true sighthound, yes.
Their entire historical purpose, hunting across vast, rugged terrains, was built on detecting the tiniest flicker of movement miles away.
Their biology is entirely oriented around their vision. They have a 270-degree field of view.
That is incredible.
It is. So when that primary sense begins to degrade, it doesn't just affect their physical navigation, it actually shatters their psychological confidence.
Oh, wow. So it changes their whole personality.
It can. During routine handling, obviously looking for redness, unusual discharge, or cloudiness in the lens is the physical check. But the behavioral check is equally critical.
Which means paying attention to how they interact with their environment.
Exactly.
Like if a dog that used to sprint through the house suddenly starts hesitating before crossing a shadow on the floor, or if they seem unusually startled when you approach them from the side.
Yeah, that isn't just them acting quirky. That is a massive red flag that their visual radar is failing.
And that concept of catching subtle behavioral shifts applies directly to their musculoskeletal system, too.
Oh, absolutely.
When you are handling their feet checking for crash pads or overgrown nails, you are also manipulating their joints. And the notes point out that a dog is rarely going to scream in agony over a mild early-stage joint sprain.
No, they hide it. But when you reposition their leg on the grooming table, you might feel a tiny fraction of a second muscular resistance.
Just a micro-hesitation.
Yes, just a subtle flinch. Catching that is the difference between treating a minor strain with a few days of rest versus letting them run on it until it tears completely.
That stoicism, that instinct to hide weakness, it leads us straight into one of the most dangerous and widely accepted myths in the entire dog world.
The dental care myth?
Yes, dental care and the myth of dog breath. The sources hammer home that persistent bad breath is not a natural canine trait. It is an alarm bell for actively rotting teeth and infected gums.
A huge alarm bell.
But I want to push back on how we process this medically for a second, because here's where it gets really interesting. As humans, if we have a severe toothache, it takes over our entire existence.
Oh, completely. You can't think about anything else.
Right. We stop eating. We can't focus. If a dog has a rotting tooth, logic says they should stop eating too. But millions of owners watch their dogs wolf down dry kibble every single night looking perfectly happy.
I know, it seems impossible.
So how can a dog possibly be in severe dental pain and still eat like a vacuum cleaner?
Well, to understand that contradiction, you really have to look at the evolutionary biology of canine pain processing. It all comes down to primal pack survival instinct.
Okay, so it's a wild instinct.
Yes. In the wild, an animal that stops eating or visibly displays weakness doesn't just go hungry. They become a target.
Oh, man.
They lose their standing in the pack, or they become prey themselves. Dogs have evolved to suppress the outward display of chronic pain to an almost incomprehensible degree.
So eating a bowl of kibble isn't proof that their mouth is healthy. It's proof that their survival drive is stronger than their pain threshold.
That is the terrifying reality. A dog will happily chew on a hard toy, play fetch, and devour their dinner while dealing with excruciating, throbbing periodontal disease.
That is so sad to think about.
It is. They will literally eat through the pain just to survive another day. This is why you cannot wait for them to tell you their mouth hurts by skipping a meal. You actually have to physically lift the lip, inspect the gums for inflammation, and smell the breath.
And the sources are completely uncompromising on how to manage this.
Yeah.
Dog-safe toothpaste, early desensitization, and a toothbrush. And never human toothpaste, right?
Never. Human toothpaste is toxic to them.
Good to note. And marketing claims aside, all those dental chews and special diets are purely supplemental. They do not replace the mechanical friction of brushing away plaque before it hardens into tartar.
Right. I mean, if you want to know the actual efficacy of a commercial dental chew, you have to look past the glossy packaging. Ask your veterinarian if the product has independent, peer-reviewed clinical data backing it up.
Because a lot of them don't.
Most of them don't. They are just empty calories that do absolutely nothing for the gum line where the actual disease takes root.
Wow. When you realize how effectively their bodies hide physical changes, whether it's masking weight loss under a heavy coat or swallowing food through blinding dental pain, it completely upends how we need to look at their overall baseline of motion.
See, it really does shift the perspective.
Because we've established how to examine a stationary dog, but health is also about dynamic observation over time.
Yes, the insidious nature of hidden weight gain is the perfect example of this.
Right.
Visual assessment is already compromised by the hair, as we talked about, but the real danger lies in the slow, creeping changes to their routine.
Yeah, the sources outline a very specific trap here. Let's say the dog hits middle age or develops a mild arthritis flare-up that they're, stoically hiding.
Which is super common.
They naturally become slightly less active. They sleep a little longer, they don't run quite as hard at the park. But the owner, out of sheer habit, continues to scoop the exact same portion of high-calorie food into the bowl every single morning.
And that creates a devastating feedback loop.
Because they aren't burning it off.
Exactly. Unchanged caloric intake paired with a subtle reduction in metabolic burn equals gradual weight gain. But because of the coat, the owner doesn't see the extra 3 pounds.
So they just keep feeding them the same amount.
Yep. And that extra weight puts increased mechanical stress on the already aching joints, which makes the dog want to move even less, which leads to more weight gain.
Until one day, the owner's brushing the dog, presses down on the rib cage, and realizes there's an inch of fat where bone used to be.
Exactly.
This elevates exercise from just, burning off energy to a critical pillar of preventive medicine. Consistent daily movement maintains the cardiovascular engine, keeps the digestive tract moving, and physically builds the muscle mass required to stabilize their joints as they age.
Movement is medicine. But, there is a secondary behavioral component to how a dog moves and interacts that often gets overlooked as a medical necessity.
What's that?
It's how they respond to being handled by strangers.
Oh, yes. I love the way this is framed in the notes, because I really want to completely dismantle how we typically view dog training today.
Let's do it.
We usually frame training as just establishing good manners, right? Teaching a dog to sit, stay, or not jump on the delivery driver is about social compliance. But teaching your dog to stand calmly on a table, to willingly accept having their paws squeezed, their mouth forced open, or their ears inspected, that is not about being polite.
Not at all.
That is crucial life-saving medical infrastructure.
Think about the physiology of a veterinary visit for an unsocialized dog. If a dog has never been practiced in accepting invasive touch, a trip to the clinic triggers a massive sympathetic and nervous system response.
Just total fight or flight.
Exactly. Adrenaline and cortisol flood their system, their heart rate skyrockets, they begin panting frantically, and every muscle in their body turns rigid.
So how is a veterinarian supposed to do their job in that scenario?
They often can't.
Right, because you can't listen for a subtle grade 1 heart murmur over the sound of panicked, hyperventilating panting. You can't palpate the abdomen to feel for a tumor if the dog's stomach muscles are locked as hard as a board.
The physical stress response literally blocks the veterinarian from gathering accurate data. The medical intervention becomes compromised.
Which is why building this at home with short positive sessions is so important.
Yes, a dog that has been systematically desensitized at home through highly rewarding sessions of handling allows the vet to perform a nuanced, accurate examination.
Which perfectly bridges the gap between the work done at home and the work done in the clinic. You take all of this tactile data, the behavioral prep, the observations, and you hand it over to the veterinary team.
It's a true partnership.
But, I can hear the frustration from a listener who just wants a straightforward roadmap.
Oh, for sure.
So what does this all mean for the owner who just wants a simple checklist? Why can't we just walk into a clinic, ask the standard Afghan Hound protocol for tests, vaccines, and parasite prevention, pay the bill, and call it a day?
Because biological risk is highly geographic and lifestyle dependent. A universal checklist is actually a dangerous illusion.
Okay, tell me more about that.
Well, take parasite prevention, for instance. A dog living in a rural, wooded area has an incredibly high exposure risk for tick-borne diseases like Lyme.
Sure.
But a dog living in a high-rise urban apartment might not see many ticks. However, they're constantly exposed to leptospirosis from urban rat populations or heartworm from a single mosquito bite on a balcony.
Oh, wow. So even indoor or urban dogs face serious parasite risks, just different ones.
Exactly. So the preventative care has to be tailored to the specific environmental threats of the dog's daily life, not just their breed standard.
That makes total sense.
And the same logic applies to blood work and screening tests. A blood panel is a magnificent diagnostic tool, but running a test is not an act of prevention.
Right, it's just gathering information.
Yes, it does not stop a disease from happening. It only provides a snapshot of organ function at that specific millisecond in time. The vet's clinical expertise is required to determine which specific tests are actually warranted based on the historical data you provide.
And a massive piece of that historical data is the medication list.
Yes, critical.
The sources issue a stark warning here. They say never, under any circumstances, administer human over-the-counter medications to a dog unless explicitly directed by a vet.
Never.
Ibuprofen might cure your headache, but a single pill can cause catastrophic, fatal kidney failure in a dog because they just lack the specific enzymes to metabolize it.
And this meticulous record of what goes into your dog's body, including every joint supplement, vitamin, or dietary additive, becomes exceptionally critical if the dog ever needs anesthesia.
Because of drug interactions.
Yes, and because anesthetic protocols are calculated on incredibly tight margins, the veterinary team must know the dog's exact current weight and every compound in their bloodstream to safely administer those drugs and wake them back up.
And while anesthesia allows for planned, controlled medical interventions, we also have to talk about the total opposite end of the spectrum, the emergency that allows zero time for planning.
This is so important for this breed.
Yeah, for a deep-chested breed like this, the specter of bloat, or GDV, is always looming.
Gastric dilatation volvulus is a catastrophic mechanical failure of the digestive system.
It sounds terrifying.
It is. Because these dogs have a very deep, narrow chest cavity, their stomach is essentially suspended inside them like a hammock.
Okay, I'm picturing that.
If the stomach fills rapidly with gas or food and the dog engages in sudden, rigorous movement or feeding routines and exercise timing are mismanaged, that suspended stomach can create a pendulum effect.
Oh, no.
Yeah, the momentum causes the stomach to literally flip over on itself, completely twisting the entry and exit points.
So the gas is completely trapped inside, just expanding like a balloon.
Yes, and as it expands, the pressure violently compresses the surrounding organs. It actually pinches off the vena cava, which is the major vein returning blood to the heart.
That is horrifying.
It is. The blood supply to the stomach tissue is severed, causing the tissue to rapidly die, and the dog goes into profound cardiovascular shock.
So this isn't a let's wait and see if they feel better tomorrow morning kind of situation.
Yeah.
This is a drive immediately to the emergency room right now situation.
Immediately, yes.
And because you can't just look at them through the coat and know exactly what's happening inside, you have to know the specific behavioral and physical markers.
Which are very specific.
Right. The sources list them as unproductive retching, where they're desperately trying to vomit but nothing comes up. A sudden, tight swelling of the abdomen. Extreme restlessness, pacing, drooling, pale gums, and eventual weakness or collapse.
Identifying those signs requires you to intimately know what your dog's normal abdomen feels like and how they normally behave after a meal. Recognizing that acute deviation from the guest line is the only way to save their life.
Which really brings this entire deep dive full circle, doesn't it? The baseline. Let's quickly summarize and distill the 4 massive misconceptions our sources aimed to shatter today.
Let's do it.
Number 1, the outdated idea that preventive care is just a yearly vaccine appointment.
Right, when in reality, it is a daily, hands-on, tactical operation.
Exactly. Number 2, that a pristine flowing coat is visual proof of a healthy dog.
The coat is the ultimate camouflage. You have to physically penetrate the parka to find the truth.
Number 3, that aggressive home observation somehow replaces the need for actual veterinary exams.
No, home observation is what provides the veterinarian with the historical data they need to actually solve the puzzle.
And number 4, the deeply held hope that if you just do all of this perfectly, it guarantees your dog will never face a serious illness.
Biology offers 0 guarantees. What this rigorous baseline does is dramatically shrink the window of avoidable risk. It ensures that when something biological does break down, you catch it in the earliest possible phase, when the medical options are the most plentiful.
And the ultimate weapon to achieve that early catch is data tracking. Keeping a record, writing down the exact weight changes, logging the dates of parasite preventatives, noting when a subtle hesitation on the stairs began.
It makes a huge difference.
Taking a slow motion video on your phone if their gait looks even a little off, and using an app like the VitalPet app to keep this all organized. It transforms a vague, unhelpful feeling of, I think he started limping a while back, into hard, actionable medical evidence.
That accumulation of data is the bridge to their senior years, because aging almost never announces itself with one dramatic cinematic collapse.
Right, it's so much more subtle.
It arrives in microshifts, a slightly slower rise from the dog bed, a marginal loss of muscle tone, a tiny hesitation. The baseline being built now is exactly what you will rely on later.
And you cannot recognize abnormal if you never took the time to meticulously map out what normal feels like. You know, we've spent this entire time unpacking how these animals are biologically hardwired to mask their vulnerabilities.
They agree effectively, yeah.
They hide massive physical regressions beneath beautiful hair. They rely on sheer primal stoicism to eat through blinding dental pain, all to avoid appearing weak to the world around them.
It's just how they survive.
And it leaves me with this thought for you, the listener, to explore on your own. In our own incredibly fast-paced, demanding lives, how many of our own minor pains or heavy, silent mental burdens are we unconsciously hiding from the people closest to us, just out of that exact same primal instinct to appear strong?
Wow. It really forces you to look at resilience in a completely different light.
Something to mull over. Until next time, thanks for taking the deep dive with us.